We have an incredibly rich community here in the Bronx. It's a borough of 1.5 million people. It's an economically challenged community, and it's a health challenged community.
Unfortunately, the Bronx is the unhealthiest county in the entire state of New York.
Over 2/3 of the Bronx is overweight or obese.
High rates of diabetes, heart disease.
We have the highest rate of teenage pregnancy in the nation, one of the lowest graduation rates.
So we have to understand the communities, the struggles, the challenges that people face in dealing with their health in their community.
For over a century, Montefiore has proudly stood as the main healthcare provider here in the Bronx. We've impacted epidemics, from TB and HIV to obesity, childhood lead poisoning, and more.
People make the institution, and it has had this reputation of progressive causes and thinking out of the box and social entrepreneurship for a very, very long period of time.
Really has displayed one of the more exceptional social missions of hospitals anywhere. We literally take as a cardinal of faith that we will care for all.
You've got a world-class institution that's absolutely a part of the community, and the community a part of us.
Today, we're finding new ways to meet the needs of our neighbors, advocating and partnering, reaching out to the disadvantaged, and providing resources in the community to help people manage their health. This is our commitment.
When physicians and others see the needs of a child or a family that have to do with housing or legal issues or education, they are automatically going to advocate for those issues.
For 40 years, our pioneering lead poisoning prevention program has met a severe urban housing crisis. At the heart of the program is its advocacy for families and the community at large.
The Lead Safe House is a place where they can come temporarily while the lead abatement process takes place at home. We also go out into the community and try to educate the public as much as we can about lead poisoning.
Community outreach and advocacy is inseparable from the medical management of childhood lead poisoning.
We've had influence in the Bronx and beyond on a range of health issues.
One of the most important ways that we can try to have an impact on the obesity epidemic is to try to reduce the excess and empty calories that are consumed by children and adolescents, particularly in the form of sugar-sweetened beverages.
Among our successes is the campaign to eliminate whole milk and reduce servings of sweetened milk in New York City public schools.
New York City school children took in 4 billion less calories as a result of that campaign.
We also bring our care deeper into the community.
Montefiore has been incredibly proactive in reaching out to community organizations all across the Bronx and making sure that they have a presence in people's lives. They provided doctors, nutritionists, exercise experts, and other health experts. They did healthy food demonstrations. They provided all sorts of testing.
Did your doctor take you off of it?
Yeah.
We've created innovative programs to help the community build healthy habits.
We're able to impact families and impact individuals in places where most hospitals don't go.
The mission of the school health program is for all Bronx children to receive comprehensive primary medical, mental health, dental, and community health services, regardless of ability to pay.
Many of our families don't have access to health clinics or hospitals, so they look towards our school health clinic as the actual hospital within the community.
The program has been so successful in schools like mine that it's expanded across the Bronx.
Because of school-based health centers, 95% of children are attending schools.
We're really on the cutting edge of mainstreaming school-based health as an essential component of care for children.
We have 3 mobile medical clinics and a mobile dental clinic. Our homeless program brings the doctor and the healthcare team right to homeless family shelters. In working with homeless children and families, we knew we were meeting a tremendous need and we're making a huge difference in the lives of families.
The medical household program was a response to those patients that were not getting medical care because they could not leave their home. We work with the caregivers to make sure that they understand the resources that are available to them. We have a team of social workers, nurses, physicians, outreach staff, and support staff that take care care of the patients.
I'm really happy with this blood pressure.
In addition to treatment, we want to know why children are obese. We want to know why is it that there are so many unintended pregnancies in the Bronx. And what we do, we create a plan so that we can address those needs before they happen. So treatment is important, but prevention is also important.
I decided to start focusing on providing a program for kids, who wanted to lose weight.
The doctor kept telling him that we got to do something because you're overweight, you could get diabetes and other things could start happening to you.
After school, I go to nutrition class.
What's so good about kale? Is anything good about kale?
And I work out.
Stop, go.
I used to go twice a week, but now I go every day. I feel better about myself now. I have more energy and I like to exercise every day.
We went to a picnic. My brother said, "Didn't you used to have a fat son?" And you even met your girlfriend there.
Yes, I did.
For Montefiore to say that we have to attend to parent-child relationships and social-emotional development of young children is cutting edge and revolutionary. It speaks to a real understanding of what actually matters in terms of long-term outcomes for those infants and toddlers growing up in at-risk environments.
We've also helped bring farmers markets and green carts to neighborhoods where few fresh and healthy options exist.
My patients, they're cancer patients undergoing chemotherapy and/or radiation therapy. We want them to understand that it's not just about eating stuff, it's about eating really good stuff that's going to help them get through their treatment.
Okay. Your squash, your pumpkin, your acorn squash, carrots, they're all beta-carotene, which is an antioxidant.
I don't want to think where the Bronx would be without an institution like Montefiore Medical Center.
Together, we can achieve even more than we already have to create not only healthy individuals, but healthy communities and a healthy society.
I'm glad that my doctor told me about the Being Fit program. I feel like a new person. I'm getting better grades in school, and it really changed my life.
It did.
This is our borough. This is the Bronx we're building. With our community and your support.